So Michelle, I'm Dr. Bill Carter. Nice to meet
Nice
you.
to meet you too.
And I understand you're here for a problem that's been a concern for you for some
Oh
time.
yes.
And what's the issue for you?
It's quite embarrassing when you get big sweat rings when you're teaching and everything,
Oh
and
my goodness.
buying clothing that you know will not show that, or wearing cardigans when it's 90 degrees out. Yeah.
Oh, that sounds terrible. Have
So,
have you tried anything to deal with this?
I have tried the dry sol
Yes,
stuff, and
yes.
that basically burnt my armpits.
Yeah, that's the prescription
Yes,
antiperspirant.
that was very painful. And they told me I had to wrap myself in saran wrap.
Oh, to get it into your skin better.
Yes, and to put it on my hands because I have it on my hands and feet too.
Oh my
I sweat
goodness.
very bad. Then I tried the Certain Dry, the stuff that you can buy at the grocery store. That works, but not too well. So now I'm here. After Haley suggested I come here.
Okay. Well, your experience is what I've heard several times from people, unfortunately. And dry sol is supposed to be the best topical antiperspirant we have,
Hmm.
and that's why it's been prescription. And unfortunately, it can either be too irritating in the sensitive area under the arms, or
Yes.
it can be not strong enough.
Okay.
Uh, in the few cases when it does work, it's inconvenient, and then it's a balance of, do I use this 3 or 4 times a week and get irritated, or once or twice a week and not be strong enough, and it's a
Yeah,
bother.
I went to bed kind of in pain quite a few nights.
Oh my.
So yeah.
Had you ever tried Botox for this?
Oh, I don't like needles that much.
Oh, all right.
So when Haley told me that this was not, well, it wasn't like Botox, because I heard for Botox you have to keep like coming back, and it's not a permanent thing.
You're exactly right. On the average, Botox will last about 9 months, and then to get continued relief, you need to repeat that when it wears
Oh.
off. Yes. So you're not a fan of that
Oh no.
approach. Now, I do have people who successfully treat it that way, but the other problem with Botox is it can be expensive.
Hmm.
It can easily be over $1,000 a treatment, and to repeat that every 6 to 12 months
That's a little expensive.
can be onerous, and very few insurance companies participate with this at all. And in practical terms, it's realistic to say there's virtually no insurance company participation with coverage for this most unfortunate condition.
Hmm.
So, have you investigated any of the surgical approaches for this?
Oh no.
Okay. Do you know what they are or what they involve? Would you like to hear a little bit
Sure.
about them? Uh, the approach that has been used most often is called thoracic endoscopic sympathectomy, where a thoracic surgeon goes in through the chest wall, finds the sympathetic chain that goes next to the spinal column, and either transects that with clips or scalpel, and basically disables the nervous system participation in sweat glands on half your body. If he
Okay.
does on the other side, that it affects the other half, and basically just part of your body is left able to sweat. And the biggest problem with that, unfortunately, is 70% of the time on average, there will be compensatory excessive sweating on, say, your head and your neck, even though from your shoulders down you'd have no sweating. It's a big problem for
So you're taking it from one place and putting it to the other.
in,
Could be.
in effect, yes. It doesn't work that way for everybody, but unfortunate for the majority. So there have then been other surgical approaches how to deal with it more locally, and for underarm sweating, for example, they can go in underneath the skin and either surgically suck out the sweat glands, or cut away the skin and do grafting, or now one of the companies just came up with an adaptation of one of the laser devices to obliterate the tissue underneath with laser. But all these things, unfortunately, are more invasive and potentially more harmful than what we're going to talk about in a second,
Okay.
which is miraDry. Do you know anything about miraDry?
I read a little bit of it online.
What do
So,
you
well,
understand
Haley
about it?
told me that you tried it.
Yes.
She said you try everything. Number two, that it takes between 1 and 2 times to do it.
It takes really 2 treatments to be maximally effective.
And number 3, she said, you don't grow hair back?
Unfortunately, that's a side effect. For some people, that's a good thing.
That's a positive.
That's a plus. Now, the other thing that's an unexpected but a totally certain side effect is you're going to lose your odor from that area, your body odor.
So, that's good, fine by me.
The sweat glands are called eccrine glands, and they manufacture a salty kind of watery solution. The odor glands are oil glands, and they empty into the pore right next to our hair shaft, and they're called apocrine glands, and they are sort of collateral damage with this procedure, as are the hair follicles. Now, being a heterosexual guy, I never shave my armpits anyway, but I haven't minded not having hair there. And that was just one treatment, and after the second treatment, I would lose the remaining few hairs that I have left. But yeah, I had the procedure done about 7 or 8 weeks ago, and I haven't used deodorant or antiperspirant since. And that was just one treatment for me. Now I'm not in the 3% like you are, who are bothered by this in a socially impactful way.
Mm-hmm.
But it was not hard to go through. Now, in fairness, it does involve needles during the 2 procedures, but then after that, it's 2 procedures and you're
I
done.
can handle that.
Okay.
I'm not coming back every 6 months.
Oh my! So it's a very good, highly effective treatment. After two treatments, the sweat is diminished 90%, and that means that all but the very, very most severe sufferers will have their problem eliminated with just 2 treatments. Interestingly, during the summer months, we're having a special. Instead of $3,000, it's going to be $2,750. So, and pay up front, 2 treatments, then you're done, and we schedule you after the first treatment for the second, and we've had several very, very satisfied people so far to date, and it's a very effective, very satisfying, very rewarding thing to do for people with this condition.
Awesome. Yeah, when she told me about it, I was like, I need to go talk.
Do you have any other questions about it, Michelle?
No.
It was a great pleasure meeting with you, and
yes,
I look forward to working with you.
Awesome.
Thank you.
Thank you.